Welcome to Sutures and Cents, where Tegaderm meets Top Line and Surgiflow meets soft costs in ambulatory surgery centers and hospital operating rooms. We talk clinical to business people and business to clinical people. I'm Mark Copeland. He's Ryan Pistone. We are Sutures and Cents. Ryan, I think our guest is must listen for surgeons. So I'm gonna urge surgeons to listen up. Do you agree with me that they should listen up to this?
Yes, and watch, because he has a great mustache.
That's right. That's right.
Yeah.
We've talked to surgeons and all they hundreds of times, and they all think they're really good at what they do. Most of them are, but they know it's hard to market. They're uncomfortable marketing it, and they certainly don't think whoever's doing their marketing for them is doing a good job. Do you have, is that a 100?
100%. They always think they should be doing this. I watched this on TikTok. Have you guys considered
exactly.
TikTok?
I see we've had the same conversations. So listen, surgeons, if you want to drive patients to your practice and be in front of the ideal patient, now, like whether that patient is bone on bone, osteoarthritis patient who still wants to go play tennis, or for my spine buddies, the patient whose radicular symptoms are down both legs, and it's keeping her from running the marathons she used to run, you should probably listen to our guest, Seth Turnoff of Custom Medical Marketing. He's funny. He's smart. He's got a great mustache, but he's also an expert on this topic of hyper-targeted patient acquisition. So let's roll, Ryan. Let's roll that interview with our buddy Seth Turnoff of Custom Medical Marketing. All right, Seth Turnoff. So, Seth, we talked a little bit beforehand, and I told you, here's what I want to know from you. You write proactive marketing, which is being in front of the ideal audience before they search for surgery. What does that mean? And it's obviously aimed toward surgeons. What's that mean? Tell me what you mean by that.
Sure. So let's take out the surgery part and let's use the word care. Before they search for care, marketing in healthcare has a pretty lame history at generating metrics and having people who are responsible for it say things like, well, because of the increased traffic and the site visits, like it's working. We need to keep going with it, and causing an increased spend and not actual results. Let's reverse that journey, the patient journey, and that there's so much noise out there. When you do a Google search for care near me, whatever type of care you're looking for, you're going to get a ton of results in the query. And then it's up to you, the healthcare consumer, to click through and find which one aligns with you, who accepts your insurance, who can get you in. Well, what's your need? Is this, a developing, spine issue? Or do you just have like a wonky knee that, it's kind of bothering you enough that you want to take action? Like, what's going on with you? And that's probably going to dictate, do you need someone this afternoon? Do you need to know that you have an appointment at 2:30 today to get insert ailment here looked at? Or is this just something you're kicking the tires on? Because healthcare consumerism is a thing where you and I have more control over where we go for care. And our out-of-pocket expenses have increased year over year to the point where if we're going in for surgery, certain consumers want to know the outcomes from previous patients. Is this surgery that I will need? Is this in your wheelhouse? No. Is this your specialty, doctor? So being in front of the ideal patient before they search for care is critical. We look at the rule of 7, right? Someone needs to see something 7 times before they take notice, before they understand the relevance of it, and start to get in the mind frame of taking action, especially with healthcare. Now, if your pain, if your ailment is very severe, it's not going to take 7 times. You're going to need action right now. You're going to need to make a decision. So
Right.
being proactive, taking the message of care for whether it's a surgeon, whether it's a practice, and being in front of your future patient is key. Get rid of the noise and just be top of mind when they're ready to take that next step in their care. Does that make sense?
Yeah. It absolutely does. And it begs like 8 questions from me. But the first one is, do the people you talk to, and it sounds like you talk to practice managers versus, I mean, maybe you're talking to surgeons as well. I'm sure you are at some point during this discovery process if somebody's trying to understand how you do this, what you do, and how you can help their practice. Do they understand, the people you're talking to, generally speaking, what you just said, which is you got to be sort of in their consciousness before they need you, so that when they're ready to need you, you're right there. Like, do they understand that?
Some yes, some no. What we do is not completely different, but it's just a little pivot from traditional digital marketing. Traditional marketing starts with a product or the service, right? You pick the product, you pick the service, and you maybe can define your audience or some type of like geographical range where you want this message to be. You pick your channel, right? Where this message is going to go out and hopefully reach the people. And then you hope that the people that need to see it, and they take action, whatever that call to action is. Our pivot is that we start with the people. We start with the people who are highest likelihood and highest value based on a specific service line or procedure. So we're communicating with individuals and households based on their consumer profiles. So to
Explain
understand this concept,
deeper, yeah.
Okay, yeah. Consumer data profiles. We find the people in our audiences by leveraging consumer data, both demographics, offline data, things like your address, your age range, your household income. And we deterministically link these offline profiles with your online profiles based on device IDs. All right. Your device ID belongs to you and it's your device, and it only changes when you get a new one. Which isn't that often. It used to be a lot more frequent, but these days people hold on to their devices for longer, which helps us. So once we link these profiles, we're able to determine whether or not this person lives within the established geographic range that we're trying to hit based on where our practice, the service geography is, right? How far people are willing to travel for service based on the procedure or service line, and whether or not these people possess very specific attributes related to the service line or procedure. For example, our total joint patient persona. The age range varies by practice. Some practices don't have any problem with Medicare-aged patients. Other practices would rather keep it, to that holy grail, that pristine non-Medicare commercial insurance total joint patient, right? So the age range varies, but the people in our audience are active lifestyle, all sports. We have pickleball and aerobics. People who lead active lifestyles, these tend to make better surgical candidates. These people have interests in orthopedics, interests in arthritis, interests in knee pain, hip pain, joint pain, and all of this is dictated by their digital profiles, the places they go online, the apps they download and use on their devices, and any type of purchases made that are logged to their online profile. So we don't care who you are. All we care about is that you fit our persona. And by leveraging the device ID, we're able to communicate with these people directly, not personal, not, hey, Cope, I hear your knee is hurting. Hey, Ryan, how's that back? Not like that.
That'd be a little creepy. Yeah.
We're not far off from that.
We're getting there.
You would like personalize it for me. It's my back.
Yeah.
It's my pain.
Yeah.
Right.
Right. What a time to be alive already. So we communicate with these people in digital channels where they already go online. So it appears our client, this practice, this surgeon, they appear everywhere, thus fulfilling that rule of 7. And again, a person's pain is personal, one of the most personal things. And depending on how severe it is, will probably dictate how quickly they respond to an ad.
Yeah. There's a lot to unwrap there. And give me an example. I of course am a New York Times reader, highbrow, very intelligent, but I Googled knee pain and I bought a bottle of Advil from Amazon without knowing my name. Is that telling you part of my consumer data profile?
So not specifically, not a bottle of Advil from Amazon, but we do track purchases. It doesn't go that specific.
Mm-hmm.
And look, the data we have is only as good as the data available. Our data, the people in our database, over 250 million of them across the country. You were going to ask me this question about, Seth, what the hell is first party opt-in permission based, right? I stole your thunder, Markham. I'm
okay.
Not really sorry, because it's a great question. And I think when we wrote that on our propaganda on our website, it was like, wow, this sounds really cool. And it is. First party, we don't buy lists. This data is ours. It belongs to us, and we're free to use it. Opt in. The people in our database have ticked a box, have checked the terms and conditions, allowing us insights into their information. And opt in, meaning they have given us this permission to use their data in a way that, whether it benefits them or not, the data is out there. So it's just being able to put it together, compile it in a meaningful way, so that when you cast a net, you're going to hopefully, cover a surface area. Our net is small and it's very specific. So we're not wasting a lot of space trying to catch every fish. We're looking for very specific fish. So when our message comes across someone in our audience, they not only understand the relevance. We're not saying you've made purchases or something. It's not like that. Like
Right.
our Mako ad for the Stryker robot. We were using this campaign since 2019, different iterations of it. Personalized procedures, less pain, shorter recovery times, more precise. Precision matters. These type of like the Stryker talking points, or the Mako talking points. Excuse me. The people in our audience, our total joint audience, they have knee pain, they have hip pain, and they're playing pickleball and they're doing it. And wherever they are in the journey, whether this has been bothering them for a while or it just started, it's our job as marketers to be in front of them and remain in front of them with our clients' message of care. Now, our flagship client, they're a 15 provider orthopedic practice. They just opened up 2 brand new locations at the beginning of August. We like to think we had something to do with that. We've been running campaigns for them since 2019. A general orthopedic practice. A couple things about this company. They've been in business for over 20 years in a small suburban community. They do a lot of community outreach, very involved with the schools. They have some billboards, which when I first learned they have billboards, I'm like, what? Billboard? Like, come on, man, digital, baby. Like, what did we? But I've since kind of like changed my tune, because I know I can't prove it. I don't have the data to show it, but I know that those billboards have helped our campaigns. when you're talking about digital marketing or any marketing for that matter, it's all about making the most effective noise, speaking directly to an audience that has relevance to the message, and being able to be there and stay there, so that when this person chooses to make a decision related to their care, that they're not going to search for you. They're already going to know who you are.
Yeah, the choice has almost already been made because they're so, if I'm following you, I think I am, they're already so comfortable with the awareness, the 7 touches, the however it is people term that, they're already down that pathway. I mean, it's, yeah, that's, I find this stuff fascinating. So let's make it so practice brings you in, says, Seth, we're doing this, right? We're on board. And you bring in the surgeons. Let's say we have a lot of surgeons in our audience and in our LinkedIn group that sort of listen to this. And I think we also have a lot of sales reps who in the med device who know those folks. You bring those, let's talk to those for the surgeons. You bring the surgeons in. How do you start with it? Do you say to them, tell me the patients you think you do best with? Or what, like, how does that go? What's your,
Sure.
what do you explain to them? They're already they're already ready to go. And now you're figuring out, okay, here's how we implement this. How do they do that?
So no offense to any surgeons out there. You get a bunch of surgeons in the room. We're not going to be as effective as we could if there was a point person who trusts the process and, was, a proxy, so to speak. Nothing against the surgeon. We would establish, like, first of all, what are you guys really good at? What differentiates you? Don't tell me we have the best surgeons. We have the best facility and the most current technology. Like, okay, next, every single practice in this country has that. Next, what makes you different? How can you speak to the community you serve and deliver what they want? Okay. And I know this isn't like, that common in healthcare, but it's getting more common, is that the patient experience and understanding the needs of the patient. Clinicians are skilled and educated and experienced and impressive. But healthcare consumers, patients today, they want it to be convenient. They want to know what they're going to pay, and they want to know that it's going to work. And they want to trust, right? What makes you different? If you told me 5 years ago that I would be like really interested and pleasantly surprised when I learned what this neurosurgeon in Dayton, Ohio, like the restaurant that he likes to go to with his family, I'd be like, what the hell does that matter? It matters because it creates connection, and it made me feel comfortable. I was like, man, I like barbecue too. Like that. Okay. Like, well, great. So I think
I too like barbecue. Yeah.
What do you know? Why don't we have barbecue together? I think that the rules have changed, and it's not so much to be just an incredible surgeon and a caregiver today. I think you have to use all the tools available, and with consolidation, with increased competition and big systems coming into smaller markets and gobbling up attention, gobbling up market share, I think the independent practices need all the aces up their sleeves they can get. And I know I've had conversations with smaller independent practices who are like, we don't like, what do we do? And the first step is identifying that you need to do something. Okay.
Yep.
There's no silver bullet in this, but whatever path they take, it has to be inspired. It has to be intentional. It has to be measurable. Okay. And I'm not just talking about metrics and site visits, right? And I've said this before that, if you do marketing and you can't tie your spend to revenue, you're doing arts and crafts. you're not doing marketing. You're just making pretty ads and you're putting them out and you're hoping people see them and you hope it works. And don't get me started if I ask you, well, how is that working? And you say, well, our patient numbers are up 4% from the same month last year. Like that's not, you're not measuring it the way that you can measure it today. And so I think that, the status quo is going to be the practice killer, and practices who are like, we've always done it this way. Well, this is how we've always done it. It's like, okay.
Yeah. Well, so there's, by the way, arts and crafts. Seth, that may have been how I first noticed you on LinkedIn.
Oh, thank you.
Yeah, I swear, because I remember somebody saying that, and I remember going like, "Oh, that's smart." And it was you. I just realized it.
It wasn't me. I plagiarized that. I totally stole it. Her name is Jessica Zampedri. She's brilliant. And I told her, I'm like, man, like I love that. I'm stealing it. I'm going to borrow it. She said, steal it. Just use it. So blessing.
I'm not saying Jessica stole it from my college professor, but that was a college. I had a college professor. I went to Temple, and it was like first day of marketing, like 101, and they were like, listen, all of you who think you're designing ads, you're in the wrong school. Go over to advertising. We deal with metrics over here. We deal with numbers. You take statistics. You're not taking art classes. That doesn't mean that you don't get to do that stuff and give your opinion on it. But your decisions are based off of numbers, not, wow, I really like that Campbell soup poster. Like,
yeah,
it's
right. I love it. Thank you for that, Ryan. Also, Ryan, both of my parents went to Temple, so we're practically related.
We're basically family.
You guys, yeah. It's funny, and Seth, but remember, this is my saying, and I stole it from Bono, I think, who stole it from somebody. Bad artists borrow, good artists steal. Right?
Yeah.
So like.
Yeah.
Yeah, you want to be good.
And really, like, Cope, what's original anymore? What is original? Do you think that all of the chord progressions, that all of the notes have been played in sequence? Do you think all the good lyrics have already been written? I don't know. But the hopeless optimist in me says, no, of course not. There's plenty. But the snarky
I think
pessimist
Marvin Gaye's estate thinks that's the case. But that's a whole different discussion. You and I can have some other time.
I mean, yeah, for sure.
But
I look forward to that.
Yeah. But okay, so you want a representative of that 15 surgeon practice to come talk to you and get a sample, an example of where to point. And it's funny. I think from my experiences, and I know Ryan's sort of parallel it. We have had hundreds of thousands of interactions with surgeons over the years, and that's they sort of understand it like a layperson, but they don't really know how to. Most of the time, speaking generally, they don't really know how to start or attack it. Right? Like you can say, "Hey, we're going to do this. Cool. What do we do first?" And I think, like so many things, that's a hard thing. But like, we talk about this. 60% of a hospital's revenue, and I say this and people don't believe me, but 60% of a hospital's revenue comes out of the operating room. A hospital, right? Like ER, ICU, whatever. 60% of the money that place comes from the operating room. You go over to an ambulatory surgery center, it's 99%. And I always joke the 1% is because like they have a soda machine. Otherwise, it's 100% of the revenue comes from the operating room. So when people try to understand, like, why is it so important that we can bring the right kind of patients to us, that we can treat, that we can help, but also the right surgical candidates, the people that will do well with surgery. It's U.S. healthcare, like it or not. That's where it is, and so that's why, like, that's the whole concept of sutures and cents. You got to understand how the total knee gets done, or how the colonoscopy or appendectomy gets done. But you got to know the reimbursement. You got to know your private insurance. This is the way the healthcare system is set up. So when you're enlisted by a group like that, you can use that practice. I know I saw on your website, and I'll rattle it off because I think these numbers capture people's attention, and then you can sort of give all the context to it. But in your rather elegant 2.5-minute video on your website, you said you had across the bottom, like you showed that what you guys are doing for this practice over a period of time has brought in 100, is bringing to the doorstep, let me put it that way, 104 spine patients a month, 228 pediatric orthopedic patients a month, 374 foot and ankle patients, 388 sports patients per month, and 502 joints patients per month to the front door anonymously, right? Like I want to, and you can speak to that, but like that's what you were just talking about. Metrics, and it's not site visits, and it's not views, and it's not thumbs up. It's like tying the marketing spend to revenue, right? So could you expand on that a little bit, what those numbers actually mean?
Sure. So those totals are averages. Some of those campaigns we run are over multiple months. Some of those were just 30 days. Those are unique patient visits. Now, they're anonymous.
And but
once
visits
they
not to the
come
website, to the clinic, right?
Once they come in for the consult or book the appointment. Visits. No, not visits, unique patients, actual individuals who came in, booked a consult during the month that we were running the campaign or the period, and were also in our audience. So let me back up to our process. I told you that we use consumer data. In that data are people's names. While we're running our campaigns, everything is anonymized. We don't care who you are. We don't care what street you live on. We only know that you fit our persona, which means that you live within the geo and you possess the attributes that we're looking for. At the end of each campaign cycle, whether it's 90 days, whether it's 60 or 30 days, however long we're running the campaign for, we're going to get the patient data from our client. This is usually just an address of every patient, and we like some kind of a unique identifier, MRN or a chart number, for every patient that was seen in that period of time. We perform what we call our patient matchback. This is where we scrub or match back the audience list against the patient list, and we match on address. So where Seth Turnoff lives at 901 Southwest 7th Street, but Catherine Turnoff became a patient, some of the ads that we deliver are to the household and the individual. So whether she saw an ad or me, because I'm her loving husband, said, man, I saw an ad for this orthopedic practice. They're right down the road, and like they have online booking, and it's pretty convenient. And you were mentioning that, that you're a klutz and you rolled your ankle. She's not a klutz, and she did not hurt her ankle at all. That's that was fictional.
Totally, you made that totally
also
up.
HIPAA compliance. I'm not going to talk about my wife like that. So when she shows up, we're going to match on the address. So being able to quantify and show our clients, look, we're not trying to get patient visits. I think that is the byproduct of our program. We do 3 things. We identify people, individuals who will be your future patients, whether it's tomorrow or next month or next quarter, or in this, what we're coming upon surgery season, which I like to call it. That's number 1. We identify the right people to become your patient. Number 2, we communicate with these people across different channels. And 3, we're able to show you data on who came in for a consult who was also in our audience. So being able to show the data, full transparency, is kind of the missing piece of the puzzle that when I started with my partners in this company, everybody was playing darts with blindfolds on. They're just doing it, and they're just throwing, and they're just putting out these ads, or they're running Google ads, or they're doing paid search, or they're doing SEO, and they're spending this money, but they have no way to bring it all together. And what does it mean? And how can we do this better? How can we iterate on what we've already done? How can we stay in front of this audience, but do it better and more meaningfully? And so each month that we run a campaign, we get better and we get smarter. And while it's still a big experiment and we're guessing that these people will be your future patient, these are very educated guesses. And so the anonymization of the campaign, like, that's critical when you're talking about marketing in a HIPAA compliant environment.
Yeah, which was going to be one of the questions I asked you, because everybody's worried about their anonymity, but everybody's worried about it, but their anonymity, but it will all, like, it's hyper, it's like that in healthcare, to the point where people are almost like, hey, HIPAA can't do it. HIPAA, like,
sure.
I don't even know if you know what that means.
And nobody wants to get pinched for violating, PHI or some kind of a HIPAA rule.
Right.
Agree with it or like it or whatever. Like, you can't get around it. So you comply, and you figure out a way to do it so that you are compliant and meaningful at the same time.
All right. What a great first part to Seth's interview. I'm laughing because Cope knows I hate doing these intros or outros. So, my big takeaway from this was Seth, hyper targeting is new to healthcare. It's not really new outside of healthcare. But it's new to healthcare. And the big thing that I took away from it that Seth talks about is using that type of data to target specific patients, not just targeting any old patients, targeting specific patients based on their consumer profile, using their device ID. So basically using offline data and online data to target the perfect patient for your practice. And what that really means that if you want to see private insurance, Mark Copeland's, who are, former D2 basketball players between the age of 50 and 60 years old, right?
Yeah.
Seth's group can help you do that. And why does that matter? Because if you get the right patients into your practice, you're going to have better results on the back end and probably get paid more, because you're dealing with, private insurance, and they tend to be a little bit easier and often pay more. So, that was my big takeaway.
Yeah. Well, I thought it was interesting that he was saying, and I think the term he used was be in front of your future patient now. And I really like that idea. And I think that's what these guys are doing. So, I'm hoping any of the surgeons that listen to us and will be getting this from me and you, pick up the phone and call him, because they've taken a time-tested, proven methodology outside of healthcare, and they're applying it to healthcare, and they can apply it to your practice rapidly. I really like it. So I'm looking forward to when we have part 2 with him in a couple of weeks. So until then, Ryan, how was that, Ryan?
That was great.
Because as you know, all bleeding stops eventually applies to both surgical patients and healthcare balance sheets. We'll see you next time on Sutures and Cents.
Bye.